Hi there, my name is Christina, and I am a mom, a nurse, and a health coach, and also a cancer survivor. And I decided to set up this YouTube page as a way to sort of um, keep track of my journey. Although there's some part of the journey that I have already been past. So I wanted to kind of update you where I am, and then I'm going to continue to share how my journey is going, some tips, and hopefully maybe some inspiration for those of you that are either going through a similar journey or maybe just hard times that just need some inspiration. So I'm 46 years old. In mid-December of 2022, while showering, I found a lump in my left breast. And to be very truthful, it didn't match anything that I had ever read about in terms of breast cancer. It wasn't painful. It was totally movable. And in fact, I wasn't even really sure that it was even a lump. So I had my husband, AJ, check it, and he was like, "You need to get that thing checked out." And I kind of dragged my feet for like a week or so. And after he kind of shamed me into going to the doctor, I went to the doctor and had him check it. And even the doctor was like, I don't really know. Like, he's like, this doesn't really match, what we know about breast cancer, but we probably should just go ahead and do a diagnostic mammogram and a biopsy or, a ultrasound just to be on the safe side. So I had that done kind of towards the end of December, right before Christmas time. And I knew the day that that was all done that I had cancer. I could tell by the radiologist when he came in and how they were measuring my lymph nodes. But they decided to do a biopsy. That was like the last week of December. And the biopsy came back positive for invasive ductal carcinoma. That was triple negative. And, but the lymph nodes were inconclusive, so they decided to do another biopsy. And I got the official results of everything on January 9th of 2023, and that really started my cancer journey. And so if you're someone that's just kind of starting your journey, I want to tell you the first few weeks, I call it the cancer chaos. Because it's just a whirlwind of appointments. It was appointments with surgeons and appointments with an oncologist and getting a port put in and all of the, a PET scan and a breast MRI and all of these things. And I just really felt like my life was just sort of out of control. And I learned very quickly that just to say yes to everything, say yes to every appointment, don't try to negotiate this day for this day, just do it and life will figure itself out. And so the beginning of February, I started my chemo journey. I did 16 rounds of chemotherapy, 12 rounds of 12 rounds of Taxol carboplatin, and that was once a week for 12 weeks. And then I did 4 rounds of AC, or some people call it the red double. And I had that every 3 weeks for a total of 12 weeks. So I had a total of 4 treatments of that. I finished my chemo journey on July 13th of 2023. I am still taking an immunotherapy called Keytruda. I will do that for an entire year. It is not chemotherapy. It is a way to boost my immune system so that my immune system will continue to fight the cancer, as well as should it ever recur, my body will recognize it, that it doesn't belong there, and immediately start to fight it. So I have that for probably another 6 months or so. On August 24th, I had a double mastectomy for a couple of reasons. One is I am triple negative, which means that there is not a hormonal component to my breast cancer. So in terms of chemotherapy and treatments, there are different receptors on cancer, 3 different receptors for breast cancer: estrogen, progesterone, and HER2, I don't have any of those. And so in my case, they just they call it the tricky cancer. They throw a lot of things at it and hope that it sticks. But there's not that receptor where they can really direct it to. Also, at the beginning of my journey, they did some genetic testing and found out that I am BRCA1 positive. And that is a gene that I received actually from my dad. Most people think of it as it's coming from women or from mothers. Sorry, I have a water bottle behind my head. I drink a lot of water. But in my case, my dad was BRCA positive. And it can cause other things besides breast cancer. It can cause prostate cancer. It can cause melanoma. It can cause pancreatic cancer. And so the two of those two together, we made the decision that I would go ahead and do a double mastectomy to reduce my risk of recurrence. So I am about 10 days out of my mastectomy. I'm feeling pretty good. Still have drains in. I have these little things called a Pico wound vac, which helps the incisions to heal, as well as helps to bring blood flow to where the surgery happened. I did make the decision that I would have reconstruction, and so I have something called expanders in, and the way that I can best describe it is it fits behind your chest wall muscle, and I say it's a place saver. So some women will have implants put in behind there where that expander is made a spot. But in my case, I'm going to have a procedure called the DEEP procedure, where they will be using my own body tissue to recreate my breasts. So currently I am in the healing phase of my mastectomy. And once that heals, then I will have radiation on the side where the cancer was, again, to reduce my risk of recurrence. Triple negative it's a naughty cancer. And so I'm trying to give myself the best chance that I can to kind of fight it off. So I pretty much have lived my life as normally as I possibly could. I was blessed to be able to work remotely during my chemotherapy phase. I am off right now during the surgical phase, but I've got 3 kids. They play ball. I would go to games as I could, and try to support them and be as active as I possibly could. And if I can give you one piece of advice, if you are facing any type of surgery for your cancer journey, I would encourage you in the weeks before to really focus on your nutrition, making sure that you are feeding your body the things that it needs. So lots of protein, lots of good carbs like fruits and vegetables, and really, really, really be active. And that could just be walking. And that's all I was doing, was walking before. My recovery has been, like, according to my surgeons, remarkable. And I really do believe that is because of that combination of those two things. So, of course, positive attitude helps with that. So I hope that you will continue to kind of follow along with this journey. I will share more about what's going on and some tips that will hopefully help other people if they face a similar journey. And, don't ever give up hope. Don't ever give up hope. Whatever higher power that you pray to, connect with that higher power. Try to be as positive as possible. Not every day is going to be easy, but I promise you that day will pass and the next day will come and it will be easier. So I wish you luck. God bless. And I will talk to you soon.